welcome to Medical Dialogues. I am Dr. Nandita Mohan, and as I have introduced you all to a couple of journals before, today I will be talking to the editor-in-chief of yet another journal, that is the Indian Journal of Cardiovascular Disease in Women. I am pleasured to introduce Dr. JYOTSNA, who is the editor-in-chief of this journal, that is the Indian Journal of Cardiovascular Disease in Women. She works as a professor of cardiology at Nizam's Institute of Medical Sciences in Hyderabad. And this journal is the only journal in the world which publishes content associated with cardiovascular diseases in female patients and also its associated problems. The editorial board members of the journal are women, which further makes the journal unique in its appeal. We welcome you to Medical Dialogues, ma'am.
Thank you for this opportunity.
So firstly, if you could just tell us about the society Women in Cardiology and Related Sciences and how actually did it originate? What was the motivation for establishing such a unique society?
Yeah, our association name is WINCARS, Women in Cardiology and Related Sciences. Actually, this concept has come long back. Whenever we are doing the rounds in the ICCU in early 2000, we used to see that there is a significant increase in the female number in the ICCU beds. We used to think why there is a sudden surge is occurring. Almost from that time onwards, we have something in our brain that there is an emerging new diseases, a manifestation of the same disease within a different way in females, which was underdiagnosed. So from the 2000 onwards to 2015, we used to have the multiple discussion with the different colleagues to talk about this situation, and we formulated exactly, yes, this is an entirely different from the men disease, even though the incidence is much more, but underrepresented. So then all together, we started a separate association that is known as the WINCARS, that is registered under the Government Society Act on 2015 with the registration number of 559. But actually, to say we started with the 5 people to thinking about it, now we have more than 500 members, both including the national and international people in this association. I am proud to say, not because of the number, because there's so many women cardiologists and related sciences people who realize the importance of the women heart diseases. So actually, I can compare this association with the WIN in the Western countries and Women Heart Foundation in the European societies. But there is a slight difference between that associations and our association, because those two are mainly considered as an intervention cardiologist or a general cardiologist. But what we realized is we have to see the human being, especially women, as a whole. So we thought that a simple cardiologist ideas is not sufficient enough. So collaboration with other allied sciences like renal diseases, endocrinology diseases, oncology diseases is very important. So actually we brought the concept of onco-gynops, onco-cardiologist, and onco-renal, and all those concepts are the later really coined by the WIN, and they started using all those associations. So mainly I wanted to say WINCAR is the only women nation-centered organization dedicated to creating awareness and serving the women with the heart diseases. The agenda of each and every team member is to fight against the heart disease, to empower women and good health for a better tomorrow.
Okay, so also what led to the establishment of the ICJDW?
Yeah, actually, this is the journal, official journal of our WINCARS. It is named as the Indian Journal of Cardiovascular Diseases in Women, ICJDW. This is among a few journals that promotes and addresses the health issues of the women, particularly in the cardiovascular diseases. As I already said, that women representation are very, very less, even in the clinical trials, even in ICMR and a big associations, even though said that a female has to be represented in 33% in all the clinical trials. Even now, after the act come more than a decade, it is not implemented. So there is a significant knowledge gaps, and we wanted to increase raise the awareness among the doctors as well as the female population in the society. So that's why we thought the publication is very, very important, because many of them are not able to communicate with other people unless it is a publication. So with that idea, we started this journal. Now we have actually DOAG recognition, that is NMC recognition, and that had a real hype for us in 2020 to increase the awareness of the ICJDW among the other people. Of course, we already have EBSEO, Google Scholar Recognition, ProQuest, Cross Reference, Red Cross, MBES, Experta Media, and all those things. I hope we wish the journal is also an excellent educational source and international standard and gets the recognition and also helps the all the people for the journal who contributes it and enriches the clinical skills of the readers on a global scale. So we are going for the PubMed recognition now.
Also, can male authors actually submit articles in the journal?
Yes, of course. It is just that we wanted to concentrate on the women heart diseases. The who is contributing is doesn't make any difference. On the fact, if you see, the cardiologists are the less in number to see in the cardiovascular the diseases to the other women. So many of the cases, women heart diseases are seen by the men. So everyone can submit it. We have a separate for the students, not only for the MBBS, even for the technical people like a CBT, cardiovascular technologist. For all of them, we run a special issues and special topics for them.
Great. Can you please tell us some of the special topics that have been recently published in the latest edition, or rather in the journal itself?
What we realized is we should go along with the present situation than talking about that has to be done, this has to be done, which is not covered previously. So during the COVID time, actually, we released a scientific statement, including the more than 54 the doctors with the different allied sciences, talking about the women health in the COVID era. So that we brought it. Who is no one is able to work at the time. All of the year we worked it and brought a special issue on the scientific statement of the cardiovascular health issues in the COVID. And the other important aspect in the female life is the pregnancy, which is very, very precious. And she is the important member of the family at that age group. So we thought we have to concentrate on the complications occurring in the pregnancy leading to the cardiovascular diseases. So many people knows that during the increase in the BP, detection of the sugar during the pregnancy is an important and requires a treatment, but many people doesn't follow them up in subsequently, which are likely to have the cardiovascular diseases after the 2 or 3 decades. So with this special issue, we brought all these and importance issues into that. Similarly to the students, especially for the cardiologists, general medicine people, the bedside that is very, very important. The diagnosis of the case and the treatment and the management is very important. So we brought the clinical cardiology book condensing all the articles which were published in the journal and including the hemodynamics and everything was included in that. Now we are planning to get another interventional book which is published as an interventional rounds in this ICJDW almost from the 2016 onwards. We are planning to get these articles as in the book forum in 2023 WCC, that is a women cardiac care. We does the multiple meetings, associations, and free camps. An annual meeting of ours is the WCC, that is women cardiac care. We hope that we could get that book issued and the next year.
And ma'am, what actually you think should motivate the authors to submit articles in this journal?
The journal is contributing to the neglected area of the women health and thus trying to disseminate this critical information which can lead to the overall improvement of the quality of the healthcare services of the whole of the society, not only for the women. If everyone realizes that, then they realize the importance of the submission to this journal. The main motivation is to bring the uniqueness of the women heart diseases because their presentations are the different, the complications are the different, management is different, and it is underrepresented in the clinical trials. So we recently we brought in heart failure in the women. Nowadays the coronary artery disease is now leading to the heart failures. So now, so also in the case of the women. So unless we know distinguish how the woman differs from the men, the same guidelines are going to be implemented to the women, which is an hazard to the women health. So the main aim is to motivate that. We wanted to fill the knowledge gaps in between the gender.
It was lovely having you on board with us, ma'am. Thank you so much for giving us your valuable time.
Thank you very much for this opportunity also. My main aim of accepting this interview also, that it is goes to each and everyone, so that they will make it aware and use it about the society as well as the journal.
That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.